The two toothbrush technique, series 5. What is the two toothbrush technique? Simply put, it is using two toothbrushes to do the oral care. The handle of one toothbrush is used to prop the mouth open, and the other toothbrush is used to clean the teeth. Why is a technique like this required? We know that doing oral care is very important to an individual's overall health and that it should be done twice a day. However, some residents present challenging situations in which to do the oral care. Some are combative and uncooperative for various reasons. Somebody may have had a stroke, and so they cannot keep their mouth open. Or residents may have various degrees of dementia and therefore cannot consistently cooperate with the caregiver. They may bite or spit at the caregiver. Because of this, there can be some hesitation or a lack of a desire on the part of the caregiver to provide oral care. The result of this is that sometimes the oral care is not done well or it's not done at all. So help is needed. Therefore, to meet the challenges that you may face, the two toothbrush technique has been created. One of the great things about this method is that the tools required are minimal. The tools are listed here: gloves, two toothbrushes, a cleansing agent, and a 4x4 gauze or a disposable cloth. There are more tools that could be used, but in this webinar, we're going to focus on 3 main tools: toothbrushes, the gauze or disposable cloth, and cleaning agents. Let's take a look at them in detail. Toothbrushes, to brush natural teeth, should always have soft bristles. The handle should be large, fat, and rubbery. The head should be small. This allows you to be more thorough with brushing. The cost of using this method may be a concern. While it's true, these toothbrushes do cost more than other toothbrushes, in the long run, these toothbrushes will not have to be replaced as often as the inexpensive toothbrushes. The inexpensive toothbrushes do not last very long, and they are not good. So they have to be replaced more often. The effectiveness of the toothbrushes, such as what you see in this slide, make the cost well worth it. Once a toothbrush is frayed or dirty, the life of them is over. They are no longer effective. In addition, toothbrushes should be replaced after an illness. A disposable cloth is used to cleanse the mouth of debris and liquid. Some homes or facilities prefer to use a washcloth that is not disposable. For a cleansing agent, there are many different brands and flavors that you can choose from. If you are using fluoridated toothpaste, it is important that the resident is able to rinse and spit. If they cannot or they cannot cooperate to do this, then they may swallow it or choke on it. So, if the caregiver cannot ensure that they will get the cooperation from the resident, then they should not be using toothpaste. Use toothpaste only if the resident can demonstrate, they can show to you that they can and will cooperate to rinse and spit. If a resident is severely physically compromised and therefore cannot rinse or spit, there are products such as Paravex. This is different from Paradex. Paravex is gel-like in its consistency and is an antibacterial mouth cleansing agent. It is not a mouthwash. It is alcohol-free, which is important because alcohol can dry out the oral tissues. It can be used as you would toothpaste, only requiring a drop on the toothbrush. The taste is mild, which is often appealing to most residents. When using a cleansing agent such as Paravex, there is no need to spit out, as the foam that Paravex produces is minimal. Foam can decrease the visibility for the caregiver, thus making it more difficult to do the oral care, and it can be uncomfortable for the resident due to the composition of Paravex. If a resident was to swallow instead of spitting out, it would not be harmful to them. Paravex is not abrasive, so it is mild on the oral tissues. And this is very helpful for people with dry mouth as it does not cut the oral tissues. The gel-like consistency is ideal in helping to move the toothbrush around for a resident who has dry mouth. Unfortunately, Paravex does not contain fluoride. We know that fluoride is important to the oral health of everyone, including those in long-term care homes. It is important to keep in mind that Paravex should be used for compromised individuals. If an individual can cooperate to rinse and spit, then they should be using fluoridated toothpaste. These pictures provide a visual of how to use the cloth with the toothbrush. The technique demonstrated here is called mop and go. While oral care can be done with different methods, we have found that the most effective way to use two toothbrushes is in conjunction with this method. This method of brushing the teeth does not require the individual to swallow or spit. Most debris and saliva is mopped up with the gauze or disposable cloth throughout the brushing procedure as shown in the picture. When using a toothbrush that has a large rubbery handle as a prop, the caregiver can feel comfortable putting their fingers in the mouth of the resident. This type of toothbrush will be less likely to slip while your fingers are in the mouth. If they were to bite down hard, they would be biting on the toothbrush handle instead of the caregiver's fingers. In addition, if a resident bites down on the brush, such as seen here, you can allow this because the bristles are soft. Then continue brushing with the second brush until you have time to place the handle in the mouth for propping purposes. If the resident bites down on the brush and does not let it go, wait, as eventually the jaw will relax a bit so that you can get the brush out. Some have tried using wedging devices. While dental clinics do use these for dental treatment, we do not recommend the use of them because it can be a choking hazard. A toothbrush is the preferred tool to prop the mouth open, as you can keep a good grip on it as the caregiver, minimizing the chances of choking. Some have also wrapped 6 tongue depressors with material hospital adhesive tape and use this as a mouth prop. While the caregiver can keep a good grip on the tongue depressors, we can't overlook the fact that the tongue depressors are in the mouth, which, if there for an extended period of time, it can get moist due to the saliva. And if the resident was to clamp down on it, it could become a choking hazard. Using a combination of the 2 toothbrush technique and the mop and go technique, the oral care can be done while the resident is still in bed or in a chair, as demonstrated in both of the pictures in this slide. However, notice in both photographs, there are 2 caregivers. The reason for this is that even though you may use the 2 toothbrush technique, you may still need the help of another person. If you are using 2 people to do the oral care, it's important that only one person is doing the talking so as not to confuse the resident. The person that's doing the talking is also usually the one that is doing the oral care. It is not necessary to use mouthwash routinely if the mouth is clean and healthy. If you choose to use a mouthwash, use non-alcohol mouthwashes as they are less drying to the oral tissues. However, there are times when mouthwashes are recommended by oral health care professionals, and this could be for various reasons. A dentist might prescribe chlorhexidine. And this is used to treat gum disease as it reduces plaque and fights gingivitis. However, the side effect of prolonged use of chlorhexidine is staining and increased tartar. It may also alter the taste of certain foods. So you want to make sure that you use it as directed by the dentist. If a resident requires the 2 toothbrush technique, or if they require 2 caregivers, this should be documented on the daily oral care plan so that it can be easily referenced by the caregiver. This way, if the caregiver happens to be someone who does not usually take care of that particular resident, they will know exactly what is to be done and able to perform efficient and effective oral care. A daily oral care plan is an effective tool for all residents. The tools shown in this webinar can be purchased from various suppliers. Here is a list of some of these suppliers. Some companies have a minimum order, so you may not be able to simply purchase 1 or 2 of the item. For pricing on the products seen in this presentation, please contact the supplier. Please note, this is only a sample list of companies that provide these products. These products and others like them may also be available through other companies. These are some additional resources that you can access. For printed resources as seen in this slide, like the Daily Oral Care Plan, they can be downloaded from the Halton website or the HOHO website. SHRTN, the Seniors Health Research Transfer Network, has created the Pocket Docket cards. These cards are for quick reference for staff, containing information on what to do, what should be reported, what to look for in the mouth, etc. The set is of 5 cards dealing with dementia, dentures, basic oral care, things like that. The card that is entitled Oral Hygiene, Dementia 1, refers to the 2 toothbrush technique. If this is something that you are interested in ordering, please see this website. Thank you.